Hello, everyone. My name is Olga Rosales-Salinas, and I'm here to present San Francisco Bay Area Moms Bloom Event and Expert Panel. On our Bloom Event is Dr. Sanjeev Jain, MD and PhD. He is a renowned allergist and immunologist practicing at Columbia Asthma and Allergy Clinic, which has 12 locations in 4 states, California, Washington, Oregon, and Idaho. And he travels to those offices every single week. So thank you so much for taking the time to be with us today. Can you tell us a little bit of background of when you knew you wanted to be a doctor and why specifically asthma and allergies?
Yes, so I wanted to be a doctor for as long as I can remember. When somebody asked me a question as a teenager, my response was, when people asked me what I wanted to do in life, my answer was a simple one. I wanted to find cure for cancer, just like a lot of other teenagers respond at that age. And over time, the allergy and immunology is what I settled with, and I'm very pleased to have that privilege to make a major difference in the lives of so many people.
How long have you been doing specifically, how long have you been working specifically at Columbia Asthma and Allergy Clinic?
Yeah, so we started this practice in Washington State back in 2005.
Okay,
Yeah, so over the years, we just grew, and now we're in 4 states.
Wow, that's so cool. And so helpful for so many moms. So today we want to talk specifically about the baby's immune system because our Bloom event focuses specifically on new and expecting moms. And if you're a mom listening in, this is such important information for you because a lot of moms don't think about this until the babies had their first outbreak. So a lot of the questions that were presented to us by our readers and our audience were really broad. So we're going to try to focus them and try to make them as impactful for the moms that have tuned in today. The first question that came in was, how can we prevent allergies while we're pregnant for the baby? So how early can allergy prevention begin? I guess is the bigger question.
Yes, so allergy prevention can certainly begin in utero itself, even before the baby is born. And there are certain factors we can't change. We can't change the baby's genes. The genes come from parents. And if parents have a history of allergies, the baby is likely to have an increased risk of developing allergies as well. But the things we can change is ensuring that mom's immune system is healthy. And so there are many things we recognize are important. Most importantly, now we recognize that a healthy microbiome or the healthy bacteria that grow in our bodies, they're very important for immune health. And so maintaining that is very important, and the way you maintain that is through a balanced diet, high in fiber and also low in some of the packaged or junk food with which may be high in sugar and fat. So a healthy diet in mom will definitely improve a baby's health as well. In addition, vitamin D we recognize to be quite important for immune health, and so we want to make sure that there is no vitamin D deficiency. That deficiency is quite common in the population these days. So checking vitamin D level and ensuring that's in the normal range, that's very important. Additional vitamins may also play a role, such as vitamin C, vitamin E, and diet which is rich in fruits and vegetables, especially all these colorful berries,
Yes.
All the healthy things, they're all important for baby's health as well.
This was top of mind because I just read another COVID article the other day on the deficiency in vitamin D specifically and how that affected COVID. Can you give us some tips on what to eat if we're trying to stay away from dairy and milk to get vitamin D in our diets?
Yes, so dairy is certainly a very good a natural source of vitamin D and calcium also. But if one is trying to avoid that exposure, then certainly, a lot of other milks are also fortified with calcium and vitamin D these days, such as oat milk or almond milk, and, all those milk are fortified. So that would also be a very good source of vitamin D and calcium both. Yeah.
Okay. How about after the baby is born? How early can we prevent allergies, or can we prevent? The question was phrased, how early can allergies develop after birth? So once the baby is born, I guess if you're breastfeeding, it's still about the baby's diet, right? Or the mom's diet. But when the baby's having their own food about 4 months, how early, I guess, can a allergy develop?
Yes. So the same principles apply with baby also, that we recognize that a healthy gut bacteria in babies may also play a role in whether they develop allergies or not, or any other kind of immune condition. In general, it is recognized that a natural birth may be preferable over C-section or surgical birth. But again, those are decisions that are not always up to the parents. So of course,
Right.
if there a medical emergency and C-section is necessary, then I would be the last person to say don't do it. But at the same time, if natural birth is possible and practical, then that is a better option in terms of reducing the risk of development of allergies or other immune conditions. Yeah, one thing we recognize is that if a baby is developing eczema or atopic dermatitis, that sort of sets off this cascade of other immune dysregulation and ultimately development of allergies. So if the baby does develop eczema or atopic dermatitis, it's very important that that be treated aggressively. And moisturizers is the most important intervention one can do. Ensuring that the skin barrier is maintained. That's very, very important. And beyond that, babies can and do develop allergies. And if there is evidence of a baby developing allergies, then avoidance of that exposure and treating that appropriately is very important as well.
There was a question that's related here. Are steroids safe to use for babies, and steroid prevention for the eczema or allergies? Is that a safe option for baby treatment?
Sorry, I didn't quite catch.
The question was, are steroids safe to use for babies?
Yeah, so we use steroids as a last resort, but if faced with a very severe inflammatory condition, which is not getting controlled by more conservative means, then it's better to use steroids than to not use steroids. So we use them as a last resort only, but it is still an option in the tools that are available to us. But uncontrolled inflammation for extended period of time is never a good thing. So whatever we can to reduce that inflammation as quickly as we can is desirable.
So you've been doing this a long time. How young have you seen a baby have an asthma episode, asthma attack?
Mm-hmm.
Called an asthma attack for babies?
Yes, so babies can and do develop asthma attack. Uh, so when one talks about asthma, it basically represents obstruction of the airways because of some inflammatory process in the airways. And allergies can be a contributing factor even at a very young age. However, most often when obstruction of the airways happens early in life, it's related to viruses, viruses such as respiratory syncytial virus or RSV or other viruses. Even cold virus is a common cause of obstruction in the airways. Flu virus can do that as well. And so whether that's asthma or not is a matter of semantics, but we do many times use steroid inhalers and other asthma medications in infancy if the person has inflammatory condition in the airways resulting in obstruction.
So let's say that mom just brought baby home. What's a clear-cut sign that they should be looking for? Or maybe they see the baby in distress and they don't know exactly what's going on. How will a mom know that it's an asthma attack?
Yes, so whenever a child has difficulty breathing, if their lips are turning blue or, anywhere else, if they clearly see evidence of labored breathing, that's the time to definitely consult a doctor and have that doctor evaluate whether one is dealing with an asthma attack or not, or if it is something else. The primary symptoms of asthma are cough, shortness of breath, and wheezing. And so if those symptoms are present, one has to consider asthma as a potential diagnosis.
Does this signify that a baby has low immunity if they have an early sign of asthma?
No, many babies have obstruction in their airways for multiple reasons, and many of them do involve inflammation. But when we follow those babies into adulthood, most of those babies do not develop asthma. And so just because a baby has obstruction in the airways for some reason or have some inflammatory condition, most of those babies will grow out of that condition and it will not lead to asthma. So I will not be super concerned about long-term outcome. But of course, in the short term, if somebody has those symptoms, those need to be treated quite aggressively.
That was actually my next question. If most of these kids who are experiencing asthma as newborns or as small babies, if they grow out of it, when we start introducing kids to foods, to young babies to foods and solids, if we're going to give them a little bit of peanut butter, what's the best way to prevent? I mean, do you have to stand there with the phone in one hand just in case? What are the big warning signs we should be looking for when we start introducing solids?
Yes, so all babies should be introduced to solid food after, say, 4 to 6 months of age. And in the past, the recommendation was that we should delay introduction of highly allergenic foods until later in childhood. And those recommendations have now totally been discredited. Babies need to be introduced to solid food and even highly allergenic food early in life, 4 months of age, 6 months of age. That's not too young to be introduced to even highly allergenic food. And if anything, early introduction of those foods may actually reduce the risk of development of allergies to those foods. However, In terms of the risk of a reaction, that's very much an individual thing. And so we see many parents who come in with their older child who has a history of severe food allergies or history of asthma. And so in that situation, very naturally, parents are much more cautious about their younger child. And the current guidelines say that even in that situation, it is safe to introduce all these highly allergenic foods at home. However, the only wrong answer is to not introduce those foods early on. And so if parents are not comfortable doing it at home, then we will be more than happy to do it in our office just to provide that additional level of safety and comfort. But it's extremely rare for a baby to develop a life-threatening anaphylactic reaction, even to highly allergenic foods. In the vast majority of cases, they may develop a rash or develop some other symptoms such as vomiting, but the first exposure typically does not lead to a life-threatening anaphylactic allergy. It doesn't mean it can't happen, but all that means is statistically that thing is quite uncommon.
That's really good news. I thought you had to be way more cautious. Well, thank you so much for joining us today. I know that you have locations here in California. Where exactly in the Bay are you located?
Yes, so we have 3 offices in the Bay Area. We have one office in Oakland, another one in Fremont, and we have a third one in Redwood City.
You're covering all of it. I love it. Thank you so much for being here. Your office is called Columbia Asthma and Allergy Clinic. Been around since 2005, if I'm remembering correctly. You can be reached online. I'll also tag you, and all the new and expecting moms that are tuning in today can have access to all the information that you just shared, as well as being able to reach your office specifically. So thank you so much for joining us today. And I know you've joined us before on this Bloom event, but hopefully you'll come back and join us again. Thank you so much, Doctor, and we hope that you have a great day. Thank you, everybody, for tuning in to San Francisco Bay Area Moms Bloom event and expert panel supporting new and expecting moms. Thank you
so much. Thank you very much. Thank you.